Hi, everybody. Today we are going to discuss a little bit about dental billing, and we have with us Sarah Lear, who is the Director of Dental Billing for Apex Reimbursement Specialists. How are you, Sarah, today?
I'm doing great. How are you?
Fantastic. Let's jump right in. Question number one for you. What does the dental billing process include?
The dental billing process is a complex process with lots of different parts and pieces that you have to have correct to make it successful. Starting from when you're capturing information from your patients the first time they call you or come into your office. So that's gathering all of that insurance information, ensuring that the patient information is correct, and then entering it into your system. Following with insurance verification before your patient ever has procedures completed in your office. So whether it's a phone call, logging onto a website, but verifying insurance information down to the codes that you plan to use for this patient is very important because you have to understand what insurance is going to cover, what amount the patient is going to owe you. And as long as you have that information right, you're able to accurately bill. At that point, once the patient has gone through, create a treatment plan for maybe what they need uh, or what you've done that day, everything in the system you've entered is going to be right. When you batch your claims out to your insurance company, we have to make sure you are attaching all of the correct attachments, your x-rays, your clinical narratives, everything that's needed to get that claim paid. The objective would be to create a completely clean claim so nothing gets stuck with the insurance companies. We make sure it goes through, no denials come back for missing information, and insurance verification is a big part of that. Uh, so is understanding the coding that goes along with dental billing. When you're billing out claims, you have to make sure that the correct codes are being used, especially for complex procedures. Following your claim submission, we have the follow-up piece, which is essentially not only working through any denials you might receive in the mail, but following up on any claims that are still outstanding to find out why they're outstanding, whether they have gotten stuck in the system, did the insurance actually receive them, what information do we need to send to get that claim paid. It's a very important part. Uh, in theory, if you've sent out a clean claim and your insurance verification was done perfect, you should not have to follow up often, but receive a payment instead. So the last piece of your dental billing is receiving those insurance payments in the mail or from your portals if you're signed up on EFT. Post those payments to your system and understand the adjustments that need to be made. Understand what the EOB is telling you so you can then enter that into your system and have a patient account be perfect from the point you start to finish.
It's all about getting paid.
It is. It is.
Okay, question number two. What are the most common problems seen in the dental billing process?
So some of the common problems that we see in, offices large and small are just not having your information correct in your system. So this is, not only maybe patient information when you're looking at your date of birth or your subscriber ID numbers, but also the insurance information. So if you're verifying insurance and you're not entering it into your PMS system and updating those specific coverage procedures, you're never going to have an accurate estimate on what the patient's going to owe versus what insurance is going to pay. I will see people either not doing insurance verification or doing it and just not entering it into the system. Another big one is fee schedules. So understanding your in-network fee schedules, entering it into your system so you're having accurate fees and estimates. Many people just bill out UCR fees and they don't really know what to collect from their patients because even if you've done your insurance verification, it says, hey, they owe 80% for this. If we don't know what fee that is, they don't know what to collect. And a lot of people just guess.
80% of what?
anything. So say they
Right.
only are going to pay 80% of a crown, right? And you're charging out your UCR fees.
Right.
Well,
Exactly.
yes. Um, Another big one is not having a proactive approach when it comes to your claim follow-up. Lots of people just wait and for any denials to come in the mail, and that's the only thing that they work. What you really need to understand is what your insurance aging report looks like, what insurance pays when, and when you really need to follow up on those claims, call that insurance company, find out where it went, why is it stuck, why haven't we been paid. You can't just wait for denials to come because you'll sit on claims that are outstanding and eventually it'll get written off for timely filing because you didn't follow up. Um, Another problem that we do see is really just consistency. So we have the front office, they're very busy. There's patients coming in, you're answering the phone, you're having to, deal with doctor requests, satisfying everyone in the office and billing always comes after that. It's when you have a moment when you can sit and really look at your reporting or post your payments. So it's hard to stay consistent and make sure that your dental billing is done, um, and you're having a successful result.
Fantastic. Question number 3. What are some strategies to improve the dental billing process?
Yes, there's many tools out there right now that are very helpful. Technology and automation are huge when you're looking at trying to improve your dental billing process. There's lots of things that you can automate or even partially automate, things like your insurance verification, or at least some of it, um, getting statuses on claims and understanding where things are without having to dig in. So utilizing some of those, technology automation to fill in those gaps is a really great way to go. Taking a proactive approach on all of your follow up and staying right up to date with anything that's outstanding, making sure things don't time out, and really giving it attention. Um, you can lose so much by not paying attention. That's one of the biggest things. So I think consistency, implementing some of these strategies with technology, automation, um, and just having a team, having someone that is going to know everything that's happening. If your insurance has been verified, has it been entered? Are your attachments on your claims? Are we following up? Have we posted these payments? So it's again can be difficult for a front office to do it because there's a lot going on, but consistency is key.
Yeah, so in summary, you would say that there are a lot of moving parts in the dental billing cycle. Got to stay on top of it and make sure you're utilizing all the tools at your disposal
Yes.
to make sure you're not making any mistakes. Thank you, Sarah. I think in future videos, we're going to perhaps tackle a little more in depth. But if you are a practice that wants to improve your dental billing, please give Apex a call. And until next time, thank you.